Hello or good day. I am by name Dr. Benita Amos Abuga, a veterinarian, and I'm really excited to commence this journey. So we'll be talking about zoonotic diseases and their importance in our world today. So we're going to start by talking about the concept of emerging and re-emerging infectious diseases. When we say a disease is emerging, it's more like a newly reported infection or disease. For example, it's going to be the emergence of MERS, which is Middle East Respiratory Syndrome, in 2014 in Jeddah and other parts of Africa, and also the emergence of SARS-CoV-2, that's the Severe Acute Respiratory Syndrome, in Wuhan, China, which occurred in 2019. So another concept with emergence of a disease, that a disease can actually also be termed emerging in a situation where it changes its clinical patterns, manifestation, virulence, or it begins to invade new geographical locations that it was not noticed before. So you can actually term that disease as being emerging also. So when we're talking about re-emerging, it's actually a disease that has been endemic. When you're talking about disease generally in the epidemiology of diseases, you actually talk, it's either they are manifesting as probably in a sporadic nature, endemic, epidemic, or pandemic, as we have seen with COVID-19. So a re-emerging disease now is an endemic disease that has been reported previously, but for some reason, maybe by virtue of a lot of actions or principles, it has been eradicated and gone into obscurity for at least 2 to 3 decades without it being seen. And then for no reason or obvious reasons, it is now reappearing years later, affecting the same population or a new population. So a typical example of re-emerging infection in recent time is the re-emergence of monkeypox in 2017. I think more recently in 2023 in Nigeria, and we had not seen any occurrence with monkeypox since it first appeared in 1971. And another good example is the re-emergence of the chikungunya virus in India, which occurred in 2006 after being quiet, or after its quiescence for over 36 years. So after this, we'll move properly into the concept of zoonotic diseases or zoonoses. This generally talks about diseases that are shared between species, that humans, animals, back and forth. So generally, but when we are talking about zoonoses, usually be more biased to diseases that humans get from animals, but humans can also give animals diseases, and most times they prefer to term it as humanosis, and then we have things like meta-zoonosis and the likes, but we are trying to deal with what humans get from animals. So just to give us a numerical illustration, more than 60% of human infectious diseases are actually zoonotic, and about 72% of these zoonoses are actually derived from wildlife, so that we can understand how serious this is. And to cap everything up, 75% of emerging and re-emerging infectious diseases are actually zoonoses. So it's really a big problem, and generally I think these values have actually been rising in recent times, and there are a lot of factors that can be attributed to this. Would say can actually be related to increase in general global population, microbial adaptation, and I think this is where the antimicrobial resistance comes in, urbanization, increased human and animal interaction. People are beginning to keep wildlife as pets. You are interacting with them. People are beginning to take or feed more on wildlife, and these interactions actually cause a lot of problem. And I think these are one of the many factors. So after giving this broad introduction, I want to now move down to talking about COVID-19. But before I dive into COVID-19 properly, I would want to explain certain concepts. I feel like because of how and when COVID-19 happened, most people have related coronavirus to COVID-19. I think if they get the back replay of how we came to that point, it might actually help to straighten certain things. So coronavirus, just to re-emphasize this, is not just attributed to COVID-19. Coronavirus are actually one of the large number of viruses that we have, especially for we that are veterinarians. These viruses actually can be attributed to a lot of diseases of veterinary import. So giving a brief scientific description of coronaviruses, they are actually enveloped RNA viruses that belong to subfamily Orthocoronavirinae, family Coronaviridae, and genus, which is more popular, coronavirus. So they're actually viruses that have a broad range of hosts, from mammalian to birds, that's aves. So you could have dogs, cats, humans, camels, pigs, and all the likes. So because of how broad these viruses are, I think work has been done to make these things easy. So that's why they are usually, most times if you notice, they are named maybe based on the symptoms that they cause or where they are found. So I'll cite certain examples to just make this point logical. So for example now, the infectious bronchitis coronavirus affects birds. You can see the name, they're using the sign. Also, we still have the transmissible gastroenteritis coronavirus. This affects pigs, and our popular severe acute respiratory syndrome, which is SARS-CoV-2, that causes COVID-19. And then to cite an example with one that's been that the name is attributed to where it was found, that's our popular MAS, the Middle East Respiratory Syndrome coronavirus. So this is just in a bit to make things, let's say, logical in terms of explanation, because these viruses are very vast and we need this kind of things to make the explanation a bit more easier. So that being said, before the emergence of severe acute respiratory syndrome coronavirus, that's SARS-CoV-1 in 2003, generally coronavirus were just known to be virus that causes flu in humans and also are the root cause of a lot of diseases of veterinary importance, like I've cited some examples previously. So I think this is just the brief cap with coronaviruses. So before still diving into COVID-19, we'll get there, I want to instill a point of how these zoonotic patterns or trends are being maintained in population. So I would use a virus or a disease that is rather very close to COVID, so that when I'm talking about the symptoms, I know it's very close, because most people know about COVID-19, but COVID-19 is sort of new, and a lot of work I'm sure is being done to make certain facts or to instill certain facts, and I would not want to make categorical statements in that light. But MAS, on the other hand, that's Middle East Respiratory Syndrome, has been around for a while, so we can actually have a conversation of the pattern and the trends and just make the concept of zoonosis or the transmission of zoonosis or the maintenance of zoonosis among species make more sense in that light. So that being said, the MAS coronavirus was first detected as a novel virus in 2012 from the sputum of a 60-year-old man in Saudi Arabia, and this case actually turned fatal, which makes a lot of sense, and this is highly similar to COVID-19 because you're talking about a man that is 60 years, he's actually a geriatric patient, so definitely you know that there's going to be immunosuppression and the possibility of a lot of underlying conditions that complicate the whole condition generally. And then if you know with COVID-19, young, let's say, individuals are actually more susceptible because their immune system is innate and immature. Same way with old people, the immune system is depreciating, and then if you have underlying conditions, you're going through stress, all of that complicates or can make a typical flu-like condition become fatal. As in the case of this man, it actually turned out to be fatal. Just as COVID-19, the symptoms of MAS is actually that of the upper respiratory distress. We'll be expecting, definitely, it will be pyrexia, that's fever. Also, there's shortness of breath, there's dyspnea, there may be gastrointestinal complication, and just a lot of array of signs. And finally, if it is not arrested, can actually lead to death. So the interesting part I've been driving to with all this gist is research that was done, or more like a seroprevalence research that was done from or using the serum of individuals that had access, or by profession or by virtue of what they love, had access to a lot of camels in the Middle East, that's dromedary camels. You notice that there was a lot of antibodies against this MAS coronavirus. This states that they actually got it from these camels by relating to them, because the seroprevalence was higher in them than those of other individuals that had no access with camels. Definitely you actually see it, because even if somebody that has access to camel was infected, they will relate with normal individuals. So as a result of that, there can actually be a transmission of this virus or this infection, but it was higher with those that have access to camels. So that denoting a linkage to these camels. Further still, the MAS virus was also linked to bats, and this is because the MAS virus is phylogenetically related to coronaviruses that originate from bats. So as a result of this whole English is to say the bats most likely infected the camels now infected their handlers or their owners. So this is just to create or give you a mental picture of how this zoonosis passed down from animals to animals and then eventually end up in humans. So finally, COVID-19. I believe we all know a lot about COVID-19 because the impact of COVID-19 was inundating globally, and it caused a lot of psychological, mental, economical impact generally. So a lot is known about COVID-19, from the symptoms, the signs, prevention. So, but I know that a lot of work still needs to be done to create notable patterns of spread. There are a lot of speculations, but I think we don't have concrete evidence yet. That is why I used most or closely related disease, which is MERS, to explain how this zoonotic disease, or as the prototype now COVID-19, is maintained in and out of the population. So we have a lot to do. So as I said, we have to be careful when we interact with animals for their safety, for your safety, and for the safety of the world at large. Because the world is actually a global village. So imagine having one infected individual on a plane. We know that there's no telling how far and how fast that can actually spread, and in no time we'd actually have a pandemic in our hands. So I'm just calling us, the general public, professionals, veterinarians, to do better to enlighten the public about the impact of zoonotic disease, and then other individuals, be careful when you relate to animals. Do the needful. If you see anything you do not understand, call your veterinarian or your physician. So thank you so much. I hope this was enlightening, and I'm sorry this video might be pretty long because it's more like an introduction. Subsequent videos are focused on just the zoonotic disease of public health importance, and hopefully you would enjoy this journey with me, and it will be very, very impactful. Thank you. God bless you.